Fatima Vilich. Yes, yes. You can say expert in
Welcome back to the Mountain Morning Show, where I am very happy to have Dr. Fatima Vilich here in studio. Welcome to the show. It's terrific to have you.
It's my pleasure.
You're a doctor who has studied many things, but most recently you have turned your practice towards functional medicine.
Exactly. It turns out the doctors got sick as well, especially if they work long hours.
Right.
And so I developed severe back problem, and my colleagues, because I'm pediatric anesthesiologist, they were giving me epidurals with steroids, and none of that helped. And I didn't get better until I found functional medicine, and I was like, oh my God, this is really working.
Wow.
And then I learned from BEST, from Dr. Mark Hyman and Dr. Jeff Bland.
Oh, wow.
And got certified in functional medicine, stopped doing pediatric anesthesia, opened my practice in Chicago. And after 3 years, I decided to move here so I can ski and practice.
Excellent. Well, there you go. And if your back was good enough to ski, we know it's worked.
Yes.
Which is awesome.
Yes.
Let's talk about what functional medicine is. From my small understanding in layman's terms, let me see if I can throw it out there and tell me if I'm right or wrong. This is what I'm interested in. As I get it, typically with medicine, we just look at, okay, so you've got some back pain, here's some medicine to take for it, or perhaps we maybe even make an adjustment if you're in the chiropractic world or something like that, and we hope that it gets better. Functional medicine, as I understand it, is looking to the very, very first source of the problem. Is that right?
It is correct. It is correct. It's actually looking to the root cause of a disease. So I'll tell you about pain. It turns out the pain is just a symptom, because everything was off in my body. I was having thyroid issue, I wasn't sleeping, so I wasn't detoxifying, I was having food allergies. This is all what happened with the lifestyle.
Right.
And I'm structurally still the same, my back is still looking the same, but my pain disappeared when I fixed all of these other problems. So right now I don't prescribe any opioids to anybody. I find out why they have a pain.
Yeah, and I've had my entire life had been told by doctor after doctor after doctor that my leg pain that was keeping me and my parents up rubbing my legs at night trying to get me to sleep as a child were growing pains. And at some point at age 18, I'm like, it can't still be growing pains. And at 25, it can't obviously be growing pains. I'm not growing anymore. And I was still having those aches and pains. And then, in fact, went another, 20 years before we found out that it was just wheat gluten. You just cut that out, problem goes away. Hard to imagine, but that's the root cause.
That's really amazing, because let's say you're giving a fantastic example. Because, for instance, if the patient has a gluten sensitivity, they may be depressed. So if you go
so many other things that go with it.
You go to conventional medicine, they'll give you antidepressant. But what a functional medicine doctor will do, will look at the food sensitivities. Because I had a patient who, as soon as he stopped gluten, which he was sensitive to, he was happy as he can be. The other things, for instance, for depression that we look for is like vitamin D deficiency. Yeah. Or maybe they are hypothyroid, or we look at active folate. Some genetic problems are associated with not enough of active folate. We just give it to the patient after we analyze genetics, and then they feel better.
Wow.
Whether they have GI infection that we cure, and then the depression and anxiety usually go together, they go away. So as you can see, there are different things that need to be addressed.
Right.
And every patient will have a different reason to be
And there may be
depressed.
several root causes. There may just be one, but that root spreads and things get to different. So not only did I have leg aches, but I also had problems with my digestion. I was having reflux, and they were prescribing medicine for that. So here I am taking ibuprofen every day, which is bad for my liver. I'm taking something for my what was thought to be acid reflux. So I'm taking a pill for that, which is the
purple pill.
Yeah, the purple pill. Yeah, something bad, which they also said, again, liver possible. My liver number is dropping because I'm doing that. So not ideal. You get rid of the one thing that was the root cause, they both go away.
Exactly.
Yeah, and so as we mentioned, I mean, it could be several roots or one, but either way, we get back to that cause.
Exactly. It is it is all connected. That's the
Right.
difference in between regular, conventional medicine and functional medicine. We are basically like super generalists. We look into everything.
I like that.
And everything is basically, it is a new paradigm. We look at your hormones, we look at your genetics, your relationship with environment, or what kind of toxins you were exposed throughout the life, infections. Lots
Right.
of people have chronic infections, and when we think that there are like 70% of people are having chronic diseases, this is really what they need to do.
When you talk about environmental, people maybe don't realize that one environmental exposure, or certainly the long-term ones that we have with our air quality, but at one time can be it too. A little spot on my lung from painting one time with a really bad paint. Didn't think that would cause a problem, but
Right.
chronic pneumonia for a couple months, 6 months, 9 months.
Right.
Yeah, lots of little things can happen just from an
They add
environmental
up.
cause.
So 1 + 1 is 3.
Right?
add up.
This is where
So-
math is a little different.
That's math is a little bit different now. You smell a little bleach. Drink water that has lead. You eat
Right.
some sushi that has a mercury. Everything adds up. I was just in Chicago. Oh my God, pollution is there. Horrible.
Unbelievably bad.
Horrible. And I was glad to come back here. I was like, I'm coming home. This is
Yeah.
already home.
Because you may not have felt bad then, but you don't know when that's going to come.
Exactly.
It can happen
Exactly.
later.
And the toxins are implicated in many diseases, in many autoimmune diseases. And our genetic is kind of lagging. We are not able to go fast and detoxify because
Right.
our genetic doesn't change quickly. And toxins are obviously causing a cancer.
I suppose if we, think about the evolution of man and look forward, at some point we're going to have some super filter built into us that comes, because clearly we're not taking this seriously, are we?
Most of the time, not, especially when we are young.
Yeah.
We feel infallible. But I'm noticing I'm seeing more and more young people in my clinic. So usually chronic diseases wouldn't happen until like 55, 60. Now my patients are 30 to 50.
Right.
Why are we getting sick so early? Because I think there's lots of exposures that we are just taking for granted.
And this, we've sort of established, I think, that many diseases are, as you said, are getting not only younger but more prevalent as well.
Yes.
And we can obviously look at environmental causes for many of these things. Certainly, we think of autism and the wildly higher numbers in autism, which we can certainly, I think, have started to attribute in some ways to environmental causes.
Absolutely.
But then in addition to that too, aren't we also looking at the fact that the way we've modified our foods may be causing some of these problems with childhood obesity and also with what am I trying to think of? The where you take the shots. Diabetes.
Yes,
So-
absolutely. That is a great point what you are bringing. We are seeing more autism now. They are finding connections with EMF, with Wi-Fi, with the cell
Wi-Fi,
phones.
yeah.
And just the study came from Greece, from Athens, and they were actually studying the proteins in the brain. They are similar to the Alzheimer's proteins, amyloid, and they are basically developed with more EMF exposure. If the pregnant woman was exposed to the cell phone, or particularly if she was sleeping in a room where Wi-Fi was
Right.
on, because it turns out we are the most sensitive during night, and these Wi-Fis also
Wow.
affect the mitochondria. These are the newest research, so that is the one reason. But there
Yeah,
are other
all the
reasons.
data from these companies that produce the phones, I mean, let's just be blunt here, has focused only on cellular damage, not on mitochondrial damage, and that is the one, as you said, is maybe more critical.
Well, mitochondria are really our energy power source,
Right.
and basically if mitochondria don't work, we don't have energy. Without energy you don't think, your immune system doesn't work, you are tired and you just feel lousy. And the other point that you were bringing is GMOs. Obviously,
Right.
GMOs will have more pesticides in them, because what they do when they put the gene in, let's say in the corn, or soy that is resistant to the Roundup, what's going to happen is like they are going to be able to spray Roundup and the plant will not die. But then when we eat it,
but we eat that Roundup.
And when we eat that, obviously it's toxins. So toxins will go in the fat, and where we have most fat, 60%, it's in our brain. So it's not a good location. So I see lots of kids with autism and attention deficit disorder, and there are lots of other, because they may have lots of GI infections.
Right.
So it's never one reason. They may have lots of GI infections. They usually don't sleep. They usually have some mineral problems. They have high copper, low zinc, dysbiosis in the gut. So food allergies, like you were mentioning, gluten, things such as that. And when all of those things are balanced, they feel so much better. They are sleeping, they are more focused, and they don't need medication.
Wow. I want to talk about the process of getting to that point, because I've, like everyone at home, I'm thinking, how do I figure out what's going on and what do I do? So I'm going to take a quick break. I want to come back and talk about that a little bit, as well as where your clinic is and where we get more information. So we're going to continue our conversation right after these messages. Welcome back to the Mountain Morning Show, where I'm talking again with Dr. Fatima Vilich. We continue our very important conversation about your health, and so many of the things that we're about to talk about and we have just previously have been discussed on this show, and we hope that as we turn back to this conversation that you'll take some of this to heart, because it can certainly change your health. And thank you so much for being here. I'm thrilled that you're here with me.
Thank you so much.
The timing on it, I think, is so appropriate, because we are finally starting to recognize in this country the fact that what we've allowed to be given to us in the way of food, and I say that because we buy it, right, is nothing like what happens in Europe. Or in some of the, like Greece, as you mentioned, is another great example. These foods that we're eating aren't even permitted in some of these countries.
Right, they don't have GMOs.
They don't have GMOs. They will not allow it. But we're kind of okay with it all of a sudden.
Right.
So, but maybe we're starting to turn the corner and realize how bad this can be.
I would hope, but it starts from every person. Going to the store and buying organic food will prevent us from getting GMOs.
Wow,
That's
yeah, exactly. Change the way we buy.
Change the way we buy, that's it.
Talk about, I want to kind of get through, for some people, the sort of process of coming to your clinic, and how we get through figuring out what's going on wrong and where we go to fix it. So let's just say that I came in for my first visit. What would that be like?
It is a much longer visit. Usually I spend 2 hours with the patient, because I take a whole history, because everything matters. Everything from the day you are born, from that day, what kind of diseases you have, and were you on antibiotics for acne or something which could have affected your gut flora, and if the gut is not healthy, we get sick.
And it can be that many years down the road that can still be causing problems.
Exactly. Well, if you are born with a C-section, you already don't have a good flora. And then you had lots of, let's say, respiratory tract infections. You got lots of antibiotics that would continue killing your flora. Yeah.
We need to talk about that one, because I think people don't realize, because a lot of people are like, hey, C-section, I'll do that, it's easy, or it's convenient. But you don't realize that you could be causing your child some real trouble, because and I'll explain this part and tell me if I'm right. Being pushed through the birth canal is the moment when the process of fluid in the lungs reverses and changes direction to now air in the lungs. And so the fluid is forced through the windpipe. It expands the windpipe. And if you don't go through the birth canal, that doesn't happen, which is why you have so many of these issues with breathing. Correct?
That can happen. That's definitely, that's very true. That's very true. And then the other one, coming through the birth canal, that's when you acquire good, flora for the gut. If you had a C-section, you're not gonna get lactobacillus and bifido and all these good bugs that we usually give now as a probiotic, because when someone
we have to give it to you.
We have to give it to you. But in the OR, we have staph or strep or MRSA, so we don't have a good flora.
Oh my.
And good flora is needed to make, vitamins, to decrease inflammation, to suppress bad flora from developing, so it is anti-inflammatory.
All right, well, I took us a little sidetrack there for a moment, but we get back to, so we'll go through this very extensive history, right?
Yes.
And as we delve through that, you're going to be looking at markers and things, right? Talk a little more about that.
Exactly. So basically, I look at everything, whether whatever they had. History is very important, because then I can get sudden clues, like, well, someone was on the birth control for 15 years. That is a huge clue that gives me idea that that was a burden to deliver. A liver couldn't detoxify. They might have accumulated lots of other toxins, and they might have developed hypothyroidism. So that's how I look at the things. And when I get whole history, I go through their lab results and whatever they have brought with. And then I order a very comprehensive test, because functional medicine has a specialty testing that are usually not done through the conventional medicine.
So it's not a Chem 7, it's like Chem 50, right?
It's kind of like that, but it will look in your biochemistry, in oxidative stress, how your mitochondria are working, do you have a DNA damage, how your amino acid, are you digesting well, do you have increased parameters for yeast overgrowth or bacterial overgrowth, how your membranes looking, are you taking enough of fish oil. So it is lots of testing, food sensitivity testing, analysis of your digestion, are you making enough of pancreatic enzymes, things such as that.
Wow.
Also, I love doing genetics, because if I have a young person who is sick, and a young is like 30, I mean, why would someone at age 30 already have chronic disease?
And it happens. Yeah.
And it happens, then I look at their genetics, not to say, okay, you're some kind of mutant. I look at genetics to find out whether they're having issue with detoxifying. Are they not able to genetically make enough of glutathione, which is a major detoxifier?
Right, in your blood, and it's hugely important.
It is hugely important to get rid of the toxins. So if they have started like that, then I will find out 4 things or 5 things, whatever their main deficits are, and they will find the supplements that they will take, and that will help them to deal with the toxins.
Wow. Tell us where your clinic is and how we can come and visit you and start this process of really what is essentially just detoxifying at the wider scope, and then much more as we start to scale it down.
Exactly. My clinic is 1910 Prospector Avenue, Suite 302, and it is in Pioneer Building across from Freshies. Right. And patients can go to my website, vibrant-health.info, and they can read a little bit more about functional medicine and read the patient testimonials.
I want to thank you so very much for being here. I'm very excited. I hope to have you back often to talk about some of these things, because there is such a wide variety of issues that we're allowing to come into our lives, both environmentally and with food, and of course some of the choices that we're making. So there's much more to talk about, and I'm looking forward to it very much.
Me too. Thank you
Dr.
so much.
Fatima Vilich, who has been so kind as to join us this morning, and I can assure you she'll be back on the program to talk more about some of these things in depth. But we have a whole nother hour of the Mountain Morning Show coming your way right here on Park City Television. We'll take a break and come back with that right after these messages. This is the Mountain Morning Show.